Hi everybody, it's Dr. Ed. The reason I'm doing this little video is because something's come up and I see it over and over as a pattern, and it's not super obvious for parents. And the chief complaint is a child who is going to the bathroom like 10, 15, 20 times, or they go 5 times in a row and then they try to pee and nothing comes out. So ever since this COVID, stuff that's going on around our world, and the fact that these kids don't go to school, or they didn't, or they were stressed when they go back to school, or all this, all the things that are coming to a child at them, where they don't feel any level of control of, they sense the anxiety, but, they don't know how to express that. One way that this is being expressed is with kids going to the bathroom multiple times. So, and then the parents usually think they have UTIs and urinary tract infections, but 99% of them do not. So, especially if they're boys, because boys have a very hard time of getting UTIs past the age of 6 months to 1 year. Girls have a much easier time because your urethra is so, short. So if there's no signs of burning, or we're not constipated, or you don't have fevers, generally speaking, don't forget about mental health. It's so important overall when it comes down to, people think, okay, mental health is mental health, physical health is physical health. There's nothing further from the truth. When you have wonderful thoughts, you create, you release your endorphins and your oxytocin, and there's a sense of being in the body. When you have chronic stress, you have cortisol released in your body, and that can destroy your gut, your brain, you can develop autoimmune disease, cancer. So, so it's very important that in Western medicine, we do a great job, of trying to integrate this model of saying, hey, you know what? If I'm stressed and chronically stressed, that's bad for my body, physically, mentally, emotionally, everything. It hurts every aspect of the body. If we have acute stress, that's okay. The body knows how to deal with it. It cleans it up. You fight and fight, you go into action, and then you're done. What you don't want is chronic stress. And so these kids are sort of going into that level of chronic stress. And what I usually do is, once we do a urine test just to make sure there's no protein in blood, make sure there's no UTIs. When we get that, we really work on the mental health, making sure the kids can communicate. You do the breathing exercises. I put something on tapping. I want you to look in that. You can learn that yourself, or you can have a coach teach that, which is awesome because you could do it at home. There's Reiki, there's yoga, there's muscle therapy, there's exercise. And, exercise also doesn't mean that I do, soccer once a week. That's the other thing we talk about, in the room, because exercise means movement every day. It's super, super important. When I was a kid, I never exercised. I just played basketball, like 3 hours. I was in incredible shape, great metabolism, and and you never thought, oh, I have to exercise. You just play. The world has changed a little bit. Now we have to structure it a lot more in the kids' lives. The kids don't have the same kind of freedom. So, exercise means finding a way, creating it. If you don't have close family members, find friends, and working together as a group to make, to find a solution. And if you have older kids, and a 7 and up, please get them in and say, this is how I solve a problem. That's another important thing. Very intellectual parents, they solve the problems. The kids never learn how to solve the problem. So as you're doing this, whether it's a book for activities and stuff like that, because you want to expand how you think, bring the kid in, say, honey, this is our problem, right? So what do you think we're going to do? What do you think is the best way? And if they don't know, show and tell the first time. The second time, ask a little bit more, so they can see how you do it, so you don't have to solve all their problems, and they can build some self-confidence. Okay, so there's a lot of little points. I started here with the urine issue. I do think that if it continues, definitely go to your doctor and do a urine test and make sure organically everything's okay. But then don't forget about the mental health, because that's what I'm seeing in most of my kids. And then use the different, there's homeopathy, there's herbs, a lot of other things that you can do for anxiety with children, but use the basic stuff. And then, if your own doctor doesn't know how to give you different remedies, then, find a naturopath or a great chiropractor who does functional medicine, or you can integrate your care if you live in part of the country where you don't have access. Look into telemedicine as well. Okay? Sending you love. Keep that in mind and have a beautiful day. Bye, guys.